The year is 2025. We live in a world forever changed by the COVID-19 pandemic. The experience has been a harsh but necessary teacher, exposing vulnerabilities in global health security and the urgent need for robust pandemic preparedness. The World Health Organization, recognizing the evolving nature of infectious disease threats, has taken a significant step forward with the 2024 update to its priority pathogen list. This updated list marks a critical departure from the past. Instead of focusing solely on individual pathogens, the WHO has shifted to a family-focused approach. This acknowledges a crucial scientific understanding. Viruses are dynamic entities, constantly evolving, and the potential for a pandemic can arise from any viral family. The 2024 list includes viral families known to cause severe human disease, such as coronaviridie, including the virus responsible for COVID-19, filoviridae, like the Ebola virus, and flaviviridae, which includes dengue, Zika, and yellow fever viruses. To accelerate the development of broadly effective medical countermeasures, the WHO has introduced the concept of prototype pathogens. These are representative viruses selected from each high-risk family. By focusing research and development efforts on these prototypes, scientists aim to create vaccines, treatments, and diagnostic tools with wider applicability, enhancing our readiness for a range of potential threats within each viral family. The 2024 list also introduces the ominous pathogen X. This designation represents the unknown, the ever-present threat of a future pandemic sparked by a pathogen we haven't even encountered yet. We must remain vigilant, investing in surveillance, research, and innovation to counter both known and unknown threats. The importance of the WHO's updated approach is underscored by a series of recent outbreaks that have tested global health systems. These events, unfolding even as the world grappled with the ongoing COVID-19 pandemic, highlight critical gaps in preparedness and underscore the need for a more coordinated and robust global response. In August 2024, Mpox, a viral disease, resurfaced, triggering a public health emergency of international concern. This outbreak, primarily impacting 12 African countries, with over 2,000 cases and 13 deaths, exposed a persistent challenge vaccine inequity. The delayed arrival of vaccines in Africa compared to wealthier nations served as a stark reminder of the disparities in access to life-saving medical interventions. Avian influenza A H5N2 emerged as another concern in May 2024, with the first human case confirmed in Mexico. This virus, while not yet demonstrating efficient human-to-human transmission, raised alarms about its pandemic potential. Simultaneously, outbreaks of a highly pathogenic avian influenza A H5N1 strain in the US and UK further fueled anxieties about a possible global spread. The Americas faced a surge in Oropouche virus infections, with over 8,000 cases reported. This mosquito-borne disease, causing debilitating fever, muscle pain, and joint pain, highlighted the vulnerability of regions grappling with existing mosquito-borne illnesses like dengue and Zika. 2 fatalities in Brazil and reports of fetal anomalies linked to the virus emphasize the potential severity of this emerging threat. Even seemingly conquered diseases resurfaced, underscoring the fragility of health systems. Polio, a disease on the verge of eradication, reappeared in Gaza in July 2024 after a 25-year absence. This resurgence, attributed to conflict-induced disruptions in healthcare and sanitation, served as a stark reminder that progress can be easily reversed without sustained commitment and investment. The recent outbreaks, while concerning, represent just a glimpse into the potential for infectious diseases to disrupt societies. History is replete with examples of pandemics that have left an indelible mark on humanity, shaping demographics, economies, and the very fabric of civilizations. The 1918 influenza pandemic, often referred to as the Spanish flu, stands as a chilling testament to the devastating power of infectious diseases. This pandemic, caused by the H1N1 influenza virus, swept across the globe, infecting an estimated 500 million people, a third of the world's population at the time, and claiming an estimated 50 to 100 million lives. the pandemic's impact extended far beyond mortality figures. Economies ground to a halt as businesses shuttered, transportation networks faltered, and workforces dwindled. Social life was upended with public gatherings banned, schools closed, and fear permeating every aspect of daily existence. The 1918 pandemic serves as a stark reminder that pandemics are not merely health crises, they are societal crises with far-reaching consequences. More recently, the COVID-19 pandemic, which began in late 2019 and stretched into the mid-2020s, provided a contemporary illustration of the interconnectedness of global health and global stability. The pandemic exposed vulnerabilities in healthcare systems, supply chains and social safety nets, underscoring the need for a more equitable and coordinated global response. The lessons from both historical and recent outbreaks are clear. The world must prioritize and strengthen pandemic preparedness. Several initiatives are already underway to enhance global pandemic preparedness, laying the groundwork for a more resilient future. The International Health Regulations, a legally binding agreement among WHO member states, provides a framework for coordinating the international response to public health emergencies. The Global Health Security Agenda, launched in 2014, aims to accelerate progress towards a world safe and secure from infectious disease threats. And the Sendai Framework for Disaster Risk Reduction, adopted in 2015, recognizes the importance of integrating biological hazards into disaster risk management. However, challenges remain. Data quality and sharing remain inconsistent, particularly in low and middle-income countries. Unequal representation in global health governance persists, with voices from these countries often marginalized. To chart a course toward a safer and more resilient future, the world must address these challenges head-on. The COVID-19 pandemic, while devastating, has provided a stark and unforgettable lesson. The world cannot afford to be caught unprepared again. By heeding the lessons of history, investing in preparedness, and fostering global solidarity, we can create a future where we are not merely reacting to pandemics, but actively preventing them and mitigating their impact. The time for action is now.